welcome. I would like to introduce you to the Belgrade course for corticobasal implantology, which we are running now already more than 1 year. This is a very unique course because on this course you can learn all the theory within 1 week. Many doctors think that to learn about corticobasal implantology it's possible on some weekend courses or by reading a few books or meeting some colleagues, but we know for sure out of our experience, out of decades of experience, that corticobasal implantology is something completely different. It's a new dentistry and it's necessary to learn this from the scratch and to really hear enough theory and to see also practical work before you can start with this in your practice. We are all sure that this will completely change your life if you take this step away from being a dentist to being an implantologist, because you can help in less time much better. You can put the masticatory system of your patients back on the feet. And well, we have met here to inform you about the course and to kind of answer your question before you can ask them. So I would like to introduce first Professor Konstantinovic from Belgrade University. He's maxillofacial surgeon, and he will explain what is his part in this course and why he thinks that you should attend it.
Thank you for introduction, Stefan. And of course, I would like to add something. I'm, as Stefan said, maxillofacial surgeon, professor of maxillofacial surgery and implantology in Belgrade University. And I think that course is unique because we are talking about basic complications in implantology. For example, I will talk about infections, I will talk about bleeding complications, about serious infections for patients that need to be hospitalized in our maxillofacial units and the patients that we treat after they were treating from another implantologist. And of course, I will take care about complications, which I think is very, very important. When we're comparing this course, which is a comprehensive course, with other courses which are offered by other companies, they just talk about good results and excellent results, but we are always not sure that everything is true. So we will give the basis of corticobasal implantology together with techniques of surgery and complications. That will be the part of my job, that course. And of course, I cordially invite you to come and to join us in Belgrade.
Thank you very much. Next, Sanela, please explain what is your part, what can the doctors expect from you, and how are you managing to train especially dentist technicians?
I'm Sanela and I'm dental technician. In our labs we develop concept how to produce very safe bridges for strategic implant concept. We would like to invite you doctors together with your dental technicians so that you could all learn how we do it, because one without the other it's not possible to make something safe and long-lasting. And we can do this in Belgrade lab, so it would be really nice if you would all come together to join us.
Yes, I can only agree. So if you work on teeth being a dentist, and then you can work virtually with every lab in your town. I mean, they do the crowns more or less beautiful, but in the end you get more or less the same result. But none of your technicians which you work with now will be able to deliver a workpiece like you need it on these implants. We can virtually treat every patient, regardless of the bone, regardless of diseases that this patient might have. But the immediate loading requires that the workpiece is ready within 3 days. This is unthinkable for the regular dentist technician to make 2 arches with 24 crowns in 3 days. But Sanela will show to the dentist technician how this is possible, how we do it with a digital protocol, and even without, let's say, too hard work. I mean, it's not that the dentist technician works 72 hours right through until it's ready. But it's done digital, it's done with milling machines, it's done on the computer, and this is what you will see and what you will learn if you come as a dentist technician to the course and if you're accompanying your dentist. Now next is Professor Lazarov, who contributes with very valuable lectures to this event in Belgrade. He's a highly experienced practitioner, many years on the job, has a clinic in Sofia, and comes to support the teaching, and he has developed his own techniques in connection with metal ceramic bridges. So please, Alex, explain what they can expect.
Thanks, Stefan, for introducing me. I'm Dr. Lazarov. I'm a teacher. Also, I'm of course part of the team. I will be presenting restoring of atrophic mandible. Also, my topic is segment restoration. Some doctors think that this system is only for full jaw restorations, but in reality, in practice, we also, with that system, we can restore any type of tooth edentulism. Also, my other topic is soft tissue grafting related to corticobasal implantology. Corticobasal implantology is immediate loading, placement, immediate loading technique, which is associated sometimes with it is associated with gums shrinkage because of healing. So this technology of soft tissue grafting makes possible to cope with these gums recessions. So in my view, this is very unique course because we now have a lot of data and all this data is systematized, and in this 1 week course all of us as lecturers, we will present to you all that data in a systematic way. So you're very welcome to join us in Belgrade.
Yes, thank you very much. Indeed, in two-stage implantology, the doctors think that if there's not enough bone, always a bone augmentation has to be done, and we all know that to augment bone or to transplant bone, to increase the amount of bone is a very unpredictable and risky thing to do. And this technology of soft tissue transplanting is a very safe procedure, and from the patient point of view or from the person's point of view who sees the patient smiling, it doesn't matter is there really bone or is there simply soft tissue in the right place. So this is what Alex is going to teach. And Antonina Ide, Dr. Antonina Ide will report about the prosthetic treatment. So what is your part?
In my lecture about prosthetic part, we are covering all topics connected with the prosthetic rehabilitation of the patients, starting with the impression taking, bite registration, and finishing with the fixing bridges and maintenance of the patient's bite. We also discuss and describe the very important step is occlusion and mastication in strategic implant technology to make it safe for the all treatment of the patient. Also, there is a very important question to discuss how to create a beautiful aesthetic result for the patient and how we approach this step to make it as easy as possible, as predictable as possible, and with the help of digital technologies.
Yes, thank you very much. There are two more teachers joining our course, but they couldn't be here in Montenegro. This is Professor Vares from Lvov and Dr. Olja Stipic from Belgrade. In her clinic also the practical demonstrations will take place. So this is really a round course. We estimate that there are 65 hours of teaching during this week, so you better sleep well and don't expect too much nightlife from Belgrade. But in this week, in these 7 days, from Monday to Sunday, you will really learn and see everything about corticobasal implantology, about predictable immediate loading, and how to approach the patient case, how to how to come to the success within 3 days, how not to lose time, and we will, of course, there are a lot more small details and problems that you will see in the daily practice. We cannot explain everything, but you will be able to stay in contact with the teachers and ask questions through our WhatsApp group. So I would say this is a very valuable course, and we see very good results with the students, which we saw already. We met one student from Spain just now here in Montenegro, and I can say this lady is really on the right track, so she knows how to do it. So this is what we have to offer, and we hope to see you soon in Belgrade. Thank you very much.